What is a stroke? A stroke is a brain attack. It happens when something blocks blood flow to part of the brain. Brain cells can't survive without oxygen and nutrients carried by blood. When blood flow stops, brain cells begin to die. This can cause lasting damage. A stroke is a serious medical emergency. Acting quickly can save brain function and even lives. Time lost is brain lost. The longer a stroke goes untreated, the greater the potential for permanent brain damage. Knowing the signs and symptoms can mean the difference between a full recovery and long-term disability.
Types of stroke. There are two main types of stroke, ischemic and hemorrhagic. Each type has a different cause, but both involve disruption of blood flow to the brain. The first type, ischemic stroke, is the most common type of stroke. An ischemic stroke happens when a blood clot blocks an artery supplying blood to the brain. The clot often forms in an area of narrowed or damaged artery, often due to cholesterol buildup, known as atherosclerosis. The second type, hemorrhagic stroke, is less common, but often more serious. A hemorrhagic stroke happens when a blood vessel in the brain bursts or leaks. Blood spills into surrounding brain tissue, causing damage. This can be caused by uncontrolled high blood pressure, aneurysms, or other blood vessel abnormalities. Understanding the causes. Stroke risk factors can be divided into two categories, those you can control and those you can't. Controllable risk factors include high blood pressure, smoking, diabetes, and high cholesterol. Uncontrollable factors include age, gender, race, and family history.
Recognizing the warning signs. Stroke symptoms often come on suddenly and without warning. Knowing the signs and acting fast is crucial. Face drooping. Does one side of the face droop or feel numb? Ask the person to smile. Is it uneven? Arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one drift downward? S. Speech difficulty. Is speech slurred? Is the person unable to speak or understand speech? T. Time to call 911. If you observe any of these signs, even if they are fleeting, call 911 immediately. Other possible stroke symptoms include sudden numbness or weakness in the face, arm or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance or coordination. And sudden severe headache with no known cause.
Treatment and recovery. Stroke treatment depends on the type of stroke, the severity, and the location of the damage. Acute treatment includes medications like clot-busting drugs, also known as thrombolytics, which can dissolve clots in ischemic strokes. Antiplatelet medications and anticoagulants prevent further clot formation. In some cases, surgical procedures may be necessary to remove a clot, repair a damaged blood vessel, or relieve pressure on the brain.
After a stroke, many people need rehabilitation to regain lost abilities and adapt to disabilities. Physical therapy helps regain strength, coordination, and mobility. Occupational therapy assists with daily living skills, such as dressing, eating, and bathing. And speech therapy addresses problems with speaking, understanding language, reading, and writing.
Preventing another stroke. Once you've had a stroke, you're at higher risk for another one, but there are steps you can take to lower your risk. Control high blood pressure. Take medications as prescribed and monitor your blood pressure regularly. Quit smoking. Smoking cessation significantly reduces stroke risk. Manage diabetes. Keep blood sugar levels under control. Lower cholesterol. Follow a heart-healthy diet and take cholesterol-lowering medications if needed. Maintain a healthy weight. Lose weight if you're overweight or obese. Exercise regularly. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Eat a healthy diet. Choose fruits, vegetables, whole grains, lean protein, and low-fat dairy. Limit saturated and trans fats, cholesterol, and sodium. Limit alcohol intake. If you drink alcohol, do so in moderation. Take medications as prescribed. This includes medications to prevent blood clots, lower blood pressure, control cholesterol, and manage diabetes. Stroke is a leading cause of long-term disability. But by understanding the risks, recognizing the symptoms, and taking preventive measures, you can significantly reduce your risk and protect your brain health.